Transjugular liver access and biopsy. The liver access and biopsy set is intended for use in obtaining liver histology samples via a jugular vein approach. The transjugular approach provides an alternative to large needle percutaneous biopsy in patients with abnormal clotting factors or in patients with ascites, which may decrease the success of routine percutaneous biopsy and increase the risk of hemorrhagic complications. The quick core biopsy needle is intended for soft tissue biopsy. Refer to the instructions for use for complete use and prescribing information. Extreme care must be exercised during manipulation and withdrawal of the catheter in order to prevent pulling the catheter apart. Insertion through a synthetic vascular graft should be avoided whenever possible. Use standard access techniques to introduce an appropriate 0.35-inch diameter wire guide into the inferior vena cava via the jugular vein. Using a selective catheter and a wire guide of your choice, catheterize the right hepatic vein or an appropriate alternative hepatic vein branch. To prevent cardiac arrhythmias, continuous cardiac monitoring is recommended while negotiating past the right atrium. Leave the wire guide in a safe distal position and remove the selective catheter. Introduce and advance the check flow performer assembly over the wire guide into the selected hepatic vein. After the check flow performer assembly is positioned within the hepatic vein, take care to prevent damage to the straight catheter when removing the straight catheter through the metal stiffening cannula. Leaving a wire guide through the straight catheter during removal may aid in preventing damage to the straight catheter. Remove the straight catheter and the wire guide. Prepare the quick core biopsy needle by pulling back on the plunger until you feel a firm click, indicating that the needle spring is locked into the ready position. The specimen notch should now be completely covered by the cutting cannula. With the stylet fully retracted, advance the quick core biopsy needle through the check flow performer assembly until the etch mark on the proximal cannula is at the hub of the check flow valve adapter. This will position the needle tip at the distal end of the access assembly. Using the directional arrow on the hub of the metal stiffening cannula, direct the check flow performer assembly and the quick core biopsy needle in the desired direction for biopsy and apply gentle forward pressure to tent the wall of the hepatic vein adjacent to the biopsy site. Advance the quick core biopsy needle out of the tip of the check flow performer assembly and into the liver tissue. Do not advance the stylet until the quick core biopsy needle is in position. While you maintain the position of the quick core biopsy needle, advance the stylet to expose the specimen notch within the area to be biopsied. Fire the cutting cannula by fully depressing the plunger to capture the tissue within the specimen notch. Withdraw the quick core biopsy needle from the biopsy area and take it completely out of the check flow performer assembly. To remove the tissue specimen, pull back on the plunger until you feel a firm click. The click indicates that the cutting cannula is locked into position. Push the stylet forward to expose the tissue specimen. Stop forward motion when you feel resistance in order to avoid engaging the quick core biopsy needle firing mechanism again. Remove the specimen from the notch.